Welcome to today's edition of The Streak. The call towards an inclusive society has been on every lip in the recent past. Despite the many calls for inclusion, little or nothing will be achieved if action is not taken. In Cameroon, one of the organizations that has been advocating for inclusion is the Cameroon Baptist Convention Health Services. In today's edition of the program, we will look back at the Cameroon Baptist Convention Health Services work on disability. My guest is the coordinator of the services of persons with disabilities with the Cameroon Baptist Convention Health Services. Mr. Awa Jacques Chirac talks to the Streak. Sir, welcome to the program.
Thank you very much, Oli. It's a pleasure for me to be on this program.
We just wanted to briefly tell us how disability work started in the Cameroon Baptist Convention Health Services.
The year 1952 marked the start of CBC's work to promote disabilities, or to, I will put it in a better way, treat disabilities in the country. 1952, CBC set up the first leprosy hospital in the northwest region, in Lingo. At the time, Hansen disease was becoming a public health burden, not just in Cameroon, but in most part of developing countries. CBC took the lead to set up its leprosy hospital in Lingo. That opened up its work in promoting services of people with disabilities. However, the years thereafter, in 1982, I often refer to it as the decade for the advent of disabilities. The world was becoming more conscious, with respect to how do we address body impairments, be it physical, sensory impairments, whatever the case at the time. Those were the emphasis. So the world at large, there was a lot of talk about it, and CBC decided to start widening the scope of its services. 1981, eye services were set up in Cameroon Baptist Hospital. As we proceeded to treat ophthalmic cases, we received lots of children. Those who could not have their sight restored ended up blind, and the question became to CBC, what about education? Every child has a right to education, but what would it mean for a child who is blind? That inspired us further to create what we called back then the CBC Integrated School for the Blind in Congo, which is, it's a household name. With the setting up of the school for the blind, we further informed ourselves, education for a child who is blind would not be limited to a school setting. It required some community-based interventions. Then that gave rise to CBR, community-based rehabilitation. In 1982, community-based rehabilitation services started, and the years thereafter have seen a steady increase or widening of scope of services to prevent first, from a purely public health sense of it, treat and rehabilitate disabilities. Hence, by 2008, CBC had ophthalmic services, education for children with visual and hearing impairment. For hearing impairment, we had created the school for the deaf in Bingo. Precisely at the time, we called it that way. We had gone ahead to also set up physiotherapy services, orthopedic services, and later on in 2010, we introduced ear, nose, and throat services. 2014, mental health services. So between 1982 to 2008, services increased sharply, and at the time, there were no formal collaborations between these services, even though they were all meant to prevent, treat, and rehabilitate disabilities. CBC, in partnership with CBN, with support from the Australian government, thought it wise to set up a comprehensive program which should, in addition to looking at disability as a public health issue, address the social and economic implications that come along with it. So that gave birth to the first comprehensive program to address disabilities in the Northwest region. And it's worth noting, at the time, it did not just bring together CBC's initiatives earlier on to prevent and treat disability, but also identified other stakeholders in the region, including Surgical and Barefoot, were all making quite some significant efforts to prevent disabilities. Everyone was brought on board so we can look at a regional approach to addressing it.
Now, after that powerful chronicling of what the CBC Health Services has been doing over the years, how can you appraise its impact on persons with disabilities who are the direct beneficiaries?
In our work as an organization, beginning 2009, we had adopted a purely development approach to addressing disabilities. Note that prior to 2009, it was more about health. But 2009, we decided to look at what is even the relationship between health, disabilities, education, livelihood, and how does all of that work to affect how someone feels in their community. So in the component of health, where we, as I mentioned earlier on, had widened the scope of services, our focus had been to prevent, treat, and rehabilitate disabilities. So in terms of impact, the first we should place a finger on is we had successfully reduced the burden of disabilities in the Northwest region. Turning to education, we had made a significant shift over the years from a focus on special education through our schools for the blind and schools for the deaf to promoting inclusive education. CBC is among the first organizations to initiate inclusive education in Cameroon in 2010. We started the first pilot for inclusive education in the Northwest region that had government secondary and primary schools take part in the pilot. And our choice of these institutions was meant to involve government, take government on board from the offset of it, and that has been rewarding. The years thereafter have been an opportunity for both government and other stakeholders who have joined the inclusion train to learn from CBC's work, who have had international organizations visit the organization to learn from what we do. But what that means in terms of impact is through our work on education, where we have created lots of resource centers, the first being the Regional Inclusive Education Resource Center in GBHS Bamenda. Thereafter, we had replicated. We had resource rooms in 7 secondary schools in the Northwest region. We've taken that practice into the French subsystem of education in Bafoussam, where it's a classic. CBC has worked with Leiden Foundation to set up a resource room as well. In the CBC education system, we've replicated the same model, and it's proven to be successful as a good way of supporting inclusion in a mainstream school. Through our work with the GCE board, we have been able to introduce revisions to the GCE board exam policies. Those revisions, and in addition to that, providing the technology for the grading and transcription of exams by the board, well in advance, has changed lots of things in terms of experiences for learners with visual impairment. So, away from education to livelihood, when we started back then, we laid so much emphasis on vocational training, and the focus was on vocational training for the blind. But the years after the 1980s have seen a sharp improvement in our options for livelihood. We now have vocational training just as an option, but also advocacy for formal employment, through which we work with the National Employment Fund. On our part as an organization, we've created an opportunity for job placements for graduates with disabilities who come on board CBC for 6 months, learn specific skills of interest. We use that as a career orientation opportunity to prepare them for the job market. We also are promoting village savings and loans initiatives, which is a sound strategy in livelihood promoted globally nowadays. These 3 options, have tended to increase opportunities for economic empowerment for persons with disabilities. Now on to social inclusion. While we find health, education, and livelihood as important elements of our work, we are also interested in ensuring that the systemic barriers that can stop anyone from participating, not just a person with a disability. We have lots of marginalized groups. Any of those barriers, be it in terms of policies, in terms of attitudes, should be dismantled in the mainstream environment, and persons with disabilities, their families, and other marginalized groups, including women and children, should participate more actively in taking decisions that affect their communities. So in our work in community, we have worked through councils, working in partnership with councils and other development structures to sell this philosophy, and it's working, serving a good majority of the population, because once opportunities are equalized or open to everyone else, again talking about impact, you have more and more people having options through which they can improve their well-being.
Now, you've talked at length, but there are three major concepts that I've been able to capture. It started with going for prevention. After prevention, you were seeking at rehabilitation. And after rehabilitation, the concept of system strengthening came in. But today, there is the concept of community-based inclusive development. What does this mean to you in terms of disability work, and what strategies have been put in place, even as an organization, to be able to implement this?
Community-based inclusive development, formally called CBIT, is, I would say, the new approach we have chosen to use. We shifted to promoting CBIT far back in 2017, when CBC took part in the first design of the global CBIT strategy. We're doing that together with CBM for WHO. That year meant, with the advent of the SDGs, organizations promoting inclusive development were looking at things a little bit differently, from a heavy focus on rehabilitation, which most organizations had, to looking at it more in terms of community development. Who should do what? So in terms of education, for example, CBID would argue whose responsibility or whose mandate it is to promote education for all Cameroonians. Is that of the government primarily? And now in the context of decentralization, councils are taking up more responsibilities in other aspects of community development, including education. So with CBIT, we are beginning to work through structures, and the approach is that of identifying the stakeholders who are responsible for each aspect of service delivery, invest in assessing and strengthening their competencies through different levels of trainings, providing advice and accompanying them, and supervising them to ensure whatever commitments they take beyond trainings are adhered to, and in that process we provide lots and lots of support. That is the approach we use in CBIT. So it's simply we assess, we capacitate, we accompany, and we evaluate what is changing. In so doing, we strengthen organizations at two levels. At the institutional level, we look at what are the policies, strategies, and generally the rules of the game. What is the rules of the game governing municipal governance in Cameroon? How should councils work? So once we understand the institutional arrangement around whatever group of stakeholders we want to strengthen, we invest in getting them to see the value of their policies and strategies to be inclusive. So if it's not, we work a way around it to mainstream disability in policy. So that's institutional strengthening, to get the policies, strategies, and rules in place, processes adequately inclusive. But it's one thing to have a policy which is inclusive, it's another thing to translate an inclusive policy into action. So at the organizational level, it's about providing the capacity to individuals in such an organization. So you have management level staff or decision level staff, and you have those always involved in operations and so on.
Now, in relation to working with councils, which is just one of the stakeholders, like you said, that which is aimed at strengthening the systems, there is certainly some expectations. So what are your expectations from these stakeholders towards ensuring that there is community-based inclusive development?
Primarily, the expectation is first put in place systems. The word system could be given different meanings, so I will specify to say policies and strategies, rules that enable participation of everyone, rules that leave no one behind, rules that foster inclusion. Second key expectation is that of having the relevant capacity to act. So if you secure or guarantee inclusion by putting in place the relevant rules, the relevant policies, be it deliberations, orders, ordinances, whatever the case, how do we ensure that year in, year out, as labor is mobile, if you have new teams in place working with you, or whatever thing happens, those who are expected to translate policy into action should have the relevant capacity to do so. So in terms of our availability to support, because it's not just about expecting people to do things, CBC has a vested interest in supporting all stakeholders who are willing to trot this path to have the relevant capacities to do so.
Thank you so much for being part of the program today. I just want to say thank you for the time, sir.
I'm indeed very grateful always for this opportunity to talk on this subject. I congratulate you and your team for this wonderful initiative. Thank you so much.
And what then is the streak? We are saying that community-based inclusive development can only be a reality in a society if we all put our hands on deck and you are involved and I am involved. That's the streak. Thank you for being part of today's program. Good day.